I have you were on a show on February 26, 2021, an interview with Dr. Judy Mikovits, where you said the following, and I quote, "We should not be giving Black people the same vaccine schedule that's given to whites because their immune system is better than ours." Can you please explain what you meant?
There's a series of studies, I think most of them by Poland, that show that to particular antigens that Blacks have a much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Poland article suggests that Blacks need fewer antigens than...
This is so dangerous.
So you get the same measles vaccine.
Mr. Kennedy, with all due respect, that is so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will be voting against your nomination because your views are dangerous to our state and to our country.
I mean, do you think science is dangerous, Senator?
Peace, you know who this is. Make sure you like, comment, and share, and subscribe to my channel and hit the bell. Also, family, donate to me if you can. PayPal and Cash App. But if you donate to me, make sure you let me know if you want me to shout you out or not. Thank you.
Family, this will be part 1 of a 3-part series. I'm just going to record this video from the heart because y'all don't understand how bad this triggered me. This is the tweet right here that made me even want to do this. Democrats are against a Kennedy being in government. What does the fact that he's a Kennedy have to do with anything? Like, what, the Kennedys are a royal family that somehow, oh, because you're a Kennedy, you can be a quack and have the craziest ideas and we just got to kowtow to you because you're a Kennedy? What kind of nonsense is that? And he's not a Democrat also. And are for Dick Cheney, the war criminal of Iraq, and Liz Cheney. Welcome to Upside Down World. They're not for Dick Cheney and Liz Cheney. They don't believe the same things as Dick Cheney and Liz Cheney. They're all just uniting against Donald Trump, the fascist. The Donald Trump, the incompetent moron who made Elon Musk, who's not even a U.S. citizen, the second most powerful man in the country, and has given him authority that no person in the history of the United States of America ever had. Elon Musk is committing multiple crimes, and he's being unchecked, he's unregulated, and he's getting away with it. The party hasn't just lost its way or its soul, it lost its mind. Why would the Democrats be losing their mind because they don't want this man as the next Secretary of Health and Human Services? He's currently that now because he got confirmed, but why would they have lost their mind because they don't want that? Like, this triggered me because some of you may not know because you just started following me. I was very big on Black health and how Black people are being treated in the healthcare system. Let me show you one of the videos that really radicalized me and got me down this path. Here we go, family.
It's time to go.
Barbara Dawson was struggling to breathe when an officer from the Blountstown Police Department entered her hospital room.
You can either walk out of here peacefully,
oh my God,
or I can take you out of here.
When she refused to leave, Officer John Tadlock tried removing her oxygen mask.
You can't take that off.
I can.
No, you can't.
Dawson was admitted to Calhoun Liberty Hospital some 7 hours earlier for stomach pains and shortness of breath.
Back, ma'am, please.
I can't
Put
breathe.
your hand behind your back.
I can't breathe.
You seem to be breathing okay right
No,
now.
I can't. Please.
Put your hand behind
I
your back.
beg you.
The 57-year-old told police and medical staff more than 10 times that she couldn't breathe, begging and pleading to stay at the hospital for treatment.
Help me. Oh, I can't
Dawson was arrested for trespassing and disorderly conduct before being escorted out of the hospital. She collapsed just feet from the police car.
When stop falling down like this and laying down, that's not going to stop you from going to jail.
Dawson would remain on the ground for approximately 20 minutes, surrounded by first responders who offered no assistance.
But you are going to go to jail, one way or the other. Okay?
Officer Tadlock and hospital workers tried and failed to move Dawson into the car, accusing the unconscious woman of being non-compliant.
Dawson, I'd really like for you to get in my car, okay? Caused a lot of us a lot of headache, a lot of aggravation.
Minutes later, a doctor instructed for Dawson to be readmitted to the hospital, where she died approximately 90 minutes later. A medical examiner determined that Barbara Dawson died from a blood clot in her lung. Meanwhile, hospital officials told police that the 57-year-old was okay and cleared for release. Dawson's relatives are considering a lawsuit against the hospital and Blountstown Police Department.
And when people yell, please and help me, you go and try to help and give them the assistance they need. And the hospital failed and the police department failed in doing that for her.
It goes back to something that we've seen in other cases in the country where when it comes to certain people, police officers tend to be far more focused on putting you in jail. I mean, it's just a overwhelming theme that we see in situations. I'm going to put you in jail. I'm going to put you in jail. When you would hope that law enforcement officers would value preservation of life even over putting a person in jail. But that's not what we have when it comes to certain people, and certainly what we saw in what happened to Barbara Dawson.
Calhoun Liberty Hospital said they continue to grieve the loss of a patient and, quote, we are setting up a medical and community task force to review best practices and better communication, unquote. 2 state Florida agencies have launched investigations into Barbara Dawson's death. Meanwhile, friends and family say they will remember her life for the generosity, guidance, and love she provided to her Florida community.
She would do anything for anyone, not just the family, but for anyone.
Marina Portnaya, RT, Florida.
As you saw, family, that was a horrible, painful death that Barbara Dawson, 57 years young, suffered for no reason. That was not necessary. And stuff like that made me do some research. And then this is what I came across. Because this issue of Black people in the healthcare system has always been on my heart for a very long time. Because of my own issues and family issues and friends and stories I've heard over the years. But this is what I came across. This is from NBC News. Links will be in the description box below. So if you want to read the whole article yourself. Blacks dying for lack of health care. More than 886,000 deaths could have been prevented from 1991 to 2000 if African Americans had received the same care as whites. According to an analysis in the December issue of the American Journal of Public Health, the study estimates that technological improvements in medicine, including better drugs, devices, and procedures, averted only 633 deaths during the same period. Look at that. Almost 1 million Black people died in less than 10 years because they didn't receive the same care as white people. That's another reason why I always refuted the whole concept that crime is the biggest issue in the Black community. Because if you take Black deaths, and like when you talking about, you take the most out there, unverifiable source with the biggest number, and you take it as truth, not even a fourth of the amount of Black people have died from murder from the 80s all the way to the 2010s. If you add it all up, you don't even get like a fourth of this number. That's from the 80s to the 2010s. This is not even 10 years. This is not even 1 decade. Almost 1 million Black people dead who should not be dead. This is people's kids, parents, grandparents, family, other family members, friends, associates, just people in the community who are dead, old, young, who should not be dead. They should be here, but they're dead because they didn't receive the same quality of care. And racism plays a huge role in that. This is what makes somebody like RFK being the health secretary such a bad, bad, bad thing. It is a big deal. Big deal. That means 5 times as many lives can be saved by correcting the disparities in care between whites and blacks than in developing new treatments. That's that. I don't even know what to say to this. I don't even know what to say. Like again, this is from 1991 to 2000. What was the number between 1981 and 1990? What was the number between 2001 and 2010? What was the number between 2011 and 2020? What's the number now? Millions of our people lost. Millions. That didn't need to be lost since the 70s. And if you read the whole article, they break down some of the reasons why that is. And here's some of the other things I found looking into this about racial disparities in healthcare, about how socioeconomics play a role, about stress related to race plays a role, limited access to healthcare plays a role, and delayed treatment plays a role. And some people, will try to make it seem like these are the bigger issues, like, delayed treatment and limited access to treatment is the real bigger issues, or poverty is the real bigger issue. Why that is not necessarily racism itself, but that's not true. And I want you to watch this next clip that will show you that's not true. Not only that next clip, next 2 clips. I'm about to play 2 clips back to back that's going to show you that it's not just, access. Because when you factor out access and you say, well, we only going to look at black people with the same access as white people, the problems are still there.
Is this racism? Is this racism in society and in healthcare, or is...
Racism is a significant contributor, I think, to it in multiple ways. Some ways in which the racism is obvious to individuals, and many ways in which the racism is not obvious to individuals. So let me give a couple examples. Back in around 2000, I was invited by the Institute of Medicine to serve on a committee that was going to address the question, what happens when blacks and other minorities get into healthcare contexts in the United States? Does their race or ethnicity make a difference in terms of the medical care they received? The report by the IOM released in 2003, it was called Unequal Treatment. And what it documented, that was across virtually every class of medical procedures, from the most simple to the most complex, blacks and other minorities receive poorer quality care and less intensive care. We were not addressing issues of access. The question was, given access to care, is there a difference in the quality of care received? And we found absolutely there was a striking difference. We did not believe, the Institute of Medicine Committee did not believe, I do not now believe, that the American physicians wake up in the morning and say, how am I going to get my minority patients today? I truly think that most medical doctors go to work, and other healthcare providers, and try to do their best for their patients. If that's true, then there's a conundrum here. How is it possible with people with good intentions seeking to do their best can nonetheless, at the aggregate level, create a pattern of care that is so discriminatory? Our answer was implicit bias. It's also called unconscious or unthinking discrimination. And when the IOM concluded that that was a contributor in 2003, there was a lot of circumstantial evidence. Today, the evidence is even stronger than it was then, that implicit bias exists among physicians and other healthcare providers, and that implicit bias affects the quality of care they provide to minority patients.
Can you help us understand a little better this implicit bias view? So I'm a doctor, a patient comes in, white, African American. What happens in my conscious or unconscious or in the interaction that becomes a generator of the kind of inequity you're talking about?
It's a great question. What the research shows is that most of us, and this is about not white people, this is about human beings, most of us think that we are driven by our conscious cognitive conditions. In fact, a lot of what we do occurs at a level beyond our conscious awareness, and is importantly driven by ideas and narratives and stereotypes that have been deeply embedded in us as part of the culture or the society in which we were raised. There's a lot of research that indicates that in American culture, African Americans, for example, are presented as lazy and dangerous and violent. Those are negative characteristics. Healthcare providers are part of the larger society. Research using the implicit association test, which is one test that tries to get at these unconscious implicit biases, finds that over 70% of all Americans have an anti-black bias. And the number for physicians is also over 70% because they are part of the larger society. We are products of the culture. So it does not reflect then the behavior of bad people. It reflects the behavior of normal Americans who are reflecting the biases and the messages about race that they have received. Importantly, what the research shows is that when we have this negative implicit bias, this negative stereotype, even though we personally are committed to egalitarian principles, without our conscious awareness, when we meet someone who fits that stereotype, we will treat them differently and honestly will be unaware that we did it because there was no intent on our part. And that's why it's called unconscious, unthinking discrimination. It's implicit, it's not explicit. You're not looking at that person and saying, I'm going to discriminate against them. In fact, if I asked you if you did, you'd say I didn't because there was truly no intent. So it's something that we need to raise awareness levels of. There are a number of strategies that can be used to help clinicians and all persons become aware of this tendency that we have. The other point I would say, this is not just about race. Race is very salient. When we meet someone in American society, the research shows, we first put them into social boxes based on age, gender, and race. So race is one of the three big factors, social factors that we focus on. But it is a more general phenomenon. If I have implicit biases or negative stereotypes about fat people, about gay people, about old people, about women, those same processes occur. So I like to tell my students that I am a prejudiced person because I am a normal human being. And if we are normal human beings, we are prejudiced because whatever society we were raised in has raised us with negative beliefs about some outgroup. Every society has in-groups and out-groups. So the question just becomes who belongs to an outgroup in the society in which you were raised, which means might be implicit in my own mind.
A new study finds African American patients are often treated differently when it comes to medicine and care. The survey of more than 500 people, 400 of them medical students, found implicit bias exists that may help explain why Black people are sometimes undertreated for pain. Among its findings, medical students believed that African Americans felt less pain than white patients and even thought their skin was thicker. For more on this perplexing discovery, we turn to Dr. David Satin of the University of Minnesota Medical Center and Dorothy Roberts of the University of Pennsylvania. Thank you both for joining us. Dr. Satin, try to describe this disparity for me. Why does this exist, and is it new?
So Gwen, we've known that this has been an issue for at least a couple decades. And every now and then a study comes out that underscores the need for the field of medicine, and in particular medical education, to do some work and get it right. So this is a problem, and it's been a problem, and hopefully this study will spur on more activity.
Dorothy Roberts, is this a medical problem or a sociological problem?
It's both. I think what's really important and fascinating about this study is that it, for the first time, links what we've long known as undertreatment of pain for Black patients with doctors, or at least medical students, false beliefs about biological differences based on race. And those beliefs, as the study's shown, are widely held by lay people as well. They're deeply embedded, long-standing myths about racial difference, especially biological differences between races, which goes back to the very concept that race is a biological difference that is widespread in U.S. society. So it's sociological as well as medical.
Dr. Satin, I have to say the thing that surprised me the most was that medical students would think this way as well as lay people. So are they being taught this? Is this something they just bring with them?
Unfortunately, it's both. So medical students, doctors are people too. We live in society and we're exposed to the same decade after decade experiences that determine our beliefs. However, one of the things one of the medical students pointed out to me this morning is that some of these false beliefs seem to peak in the second year of medical school, as students prepare for the boards and have been memorizing these associations to answer on the board exams.
This is a taught behavior or action. This is a conscious stereotype as well as a subconscious one.
Absolutely. It's deeply rooted and fundamental to the way medical education works in the United States. Students are taught to notice the race of their patients, to treat their patients differently because of race, and they're taught that that's because of fundamental biological differences between people of different races. So while this is in part based on myths and stereotypes that are widely held in U.S. society, it's also based on the way students are taught to treat patients in medical schools. It requires a radical change in medical education to address this, not only addressing implicit bias, but also changing the way in which human beings are treated and differences are considered in medical education.
David Satin, there are actually, to be fair, race, not specific exactly conditions, but medicines and conditions which are more likely to affect one race or the other.
Those are controversial. We know that race is actually a socially constructed concept. It's not biological, nor is it genetic, as we learned from the Human Genome Project. And so while there are some associations, those are largely due to social effects, how we're raised, often ethnicity plays a factor, but they are not biological effects.
But environmental effects, perhaps?
Well, I think what's really important for medical students to understand and for their teachers to teach them is the difference between health outcomes, disparate health outcomes, and the idea that they're caused by innate biological difference, which is false, versus how racism does affect health based on social inequality, not because of innate biological or genetic differences between the races. And this study points out how dangerous it is to continue to teach medical students that race is a biological category that produces these differences in health or experience of pain based on biological differences between the races.
Well, let me ask you both. This was not a huge study. This is 400 or 500 people. But what is your thinking? I'll start with you, David Satin, on what the consequences are of these beliefs and what should be done about it.
So the consequences of the beliefs we saw in the study is part of what results in unequal treatment. It's part of what results in health disparities. There's certainly enough blame to go around for how those result, but it's a component. And what it teaches us is that we need to be proactive. I teach the medical students, look, it's not your it's not your fault that you have these implicit biases. You grew up in society. We all have these. But now that you know, it's your responsibility. And we have some interventions to try to reverse that.
But it also requires a fundamental change in the way in which medical education works, moving away from teaching students that the races are different because of some kind of innate biological difference that then causes health disparities, and instead showing how racism and other structural inequities cause health disparities, and explore with students how medical practice can address those.
Dorothy Roberts of the University of Pennsylvania and Dr. David Satin of the University of Minnesota Medical Center. Thank you both very much.
Thanks, Glenn.
Thank you for having me.
As you heard, family, in the first clip, the doctors said even when you factor in access and you just factor that in, it's still a racial problem because a bunch of these doctors and healthcare professionals have a bunch of implicit racist beliefs. And as you saw in the second clips, a bunch of them just have outright racist beliefs that are pure pseudoscience. Pure pseudoscience. We don't need somebody like RFK Jr. in this position because we need a health secretary who actually understands these issues, understands the racial issue with healthcare, and can go out and address it. Go out and address it. That's what we need. We need somebody like that. We don't need him. We don't need somebody a quack who believes a bunch of racist nonsense and misrepresents studies about Black people and their healthcare concerns. And I also want to play this next clip. This clip is about Serena because people are still doubt that this is they'll think that it's mainly just a poverty issue, or when you say access, what kind of access? Well, here's Serena Williams, who has all the access in the world, and she almost died. She almost died. And on top of that, they're going to talk about why access should not be a problem. It should not be an issue, and how healthcare professionals are supposed to work around that and help close that gap. But you think they're going to do that under somebody like RFK Jr.? I don't think so, but here, let's watch this clip.
This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Nermeen Sheikh.
Tennis star Serena Williams and her husband, Reddit co-founder Alexis Ohanian, recently welcomed into the world their daughter, Alexis Olympia Ohanian Jr. The baby was born on September 1st by emergency C-section. Williams recently told Vogue magazine how she self-diagnosed a life-threatening emergency after giving birth. Shortly after delivering, the tennis star suddenly felt out of breath and assumed she was having a pulmonary embolism given her history of blood clots. According to Vogue, quote, she walked out of the hospital room so her mother wouldn't worry and told the nearest nurse between gasps that she needed a CT scan with contrast and IV heparin, a blood thinner, right away. The nurse thought her pain medicine might be making her confused. But Serena insisted, and soon enough a doctor was performing an ultrasound of her legs. I was like, a Doppler? I told you I need a CT scan and a heparin drip, she remembers telling the team. The ultrasound revealed nothing, so they sent her for the CT, and sure enough, several small blood clots had settled in her lungs. Minutes later, she was on the drip. I was like, listen to Dr. Williams. While Vogue did not identify the hospital, several news outlets reported St. Mary's Medical Center in West Palm Beach is the hospital where Serena Williams gave birth.
What happened to Serena Williams is not an isolated event. Every year in the United States, between 700 and 900 women die from causes related to pregnancy and childbirth. For every woman who dies, dozens more experience severe and sometimes life-threatening complications annually. Here in New York City, Black mothers are 12 times more likely to die than white mothers. That staggering statistic comes from a new investigation by ProPublica. For more, we are continuing our conversation with with Annie Waldman in part 2, a reporter at ProPublica who wrote the article, How Hospitals Are Failing Black Mothers. The article reveals that women who deliver at hospitals that disproportionately serve African-American mothers are at a higher risk of danger. The piece is part of a larger year-long ProPublica investigation called Lost Mothers, Maternal Care and Preventable Deaths. We began, Annie, this segment by talking about Serena Williams. Clearly, you assume she and her Reddit founder husband are at one of the top hospitals you would expect. And yet she even is getting inferior care. Can you comment on what happened to her? And then we'll talk about situations like Erica Garner, who died at the age of 27, the anti-police brutality activist in New York City, 4 months after giving birth to her second child.
Certainly. Serena Williams is the queen of the court, one of the world's greatest athletes, if not the world's greatest athlete right now. She's a multimillionaire along with her husband. Obviously, they have incredible medical coaches for her career, for tennis. But you would assume that she also has one of the greatest doctors who's working on her as she's giving birth, who she's able to see and can identify that she is a high-risk patient. Serena Williams, a few years ago, had a blood clot, which puts her at a much higher risk of having blood clots during birth. And on top of that, she had an emergency cesarean, which if you look at ACOG, which is the American College for Gynecologists and Obstetricians, they will even mention that a cesarean section puts you at higher risk. So with these risk factors, it's shocking to me that she went into the hospital knowing this, felt that she had the symptoms of a pulmonary embolism, told the medical staff around her that she had perhaps a pulmonary embolism, and that they still doubted her with all of her experience, doubted her with her intelligence, doubted her with the knowledge of her own body, which she knows best. And so this is really emblematic of a much larger problem in this country, where the Black women, their concerns about their health, about pain, about everything that happens to them in a hospital can sometimes be ignored. And more broadly, the fact that they have experienced much higher rates of birth complications. And these things are not unconnected. They're definitely connected. And so if you see Serena Williams, who is a superstar, and this happens to her, you can only imagine what happens to the multitude of mothers out there who are middle class, lower income, who don't have insurance, who are on Medicaid, who are in inner city hospitals. Where is their Vogue article? They're not going to have it, right? So essentially, what happened to her, she was still ignored. We have to also listen to the experiences and the stories of women who are frequently ignored.
Well, Annie, in the ProPublica investigation, the investigation revealed that the hospitals with high maternal mortality rates take on patients who have less access to consistent quality prenatal care. Obviously, this is not the case with Serena Williams, or have chronic health issues like diabetes or heart disease that make pregnancy and childbirth riskier. So the question there is, do hospitals need to be reformed? I mean, obviously, from what the investigation finds, they do, but it seems that the problem is much more systemic of the provision of suitable health care.
Right. I mean, it is systemic. And, this was something that we really discussed in our newsroom. For example, Black women have higher rates of heart disease. Is this something that contributes to the higher rates of death, or is it the hospital, right? But it's not either or. It is actually both. The fact is that hospitals are responsible for all women who walk into their doors. They're responsible not only for having equal care, but care that suits their needs. This is not about equal standards of care. This is about making sure that high-risk women, regardless of their race, have the medical care that they deserve when they walk in those doors. And if women without health insurance, women on Medicaid, Black women are at higher risk of things like pulmonary embolism, diabetes, hypertension, that should be noted when they walk in the doors of a hospital.
As you heard, family, that's why I use Serena, because I wanted to show you it's not just about access. And also, as you heard the lady say at the end, the doctors, the hospitals, the healthcare professionals are not actually providing care suited to the Black people's need. They're not providing the care that's suited to Black women's need, Black children, Black elderly, Black men. They're not providing care suitable to our needs. But this is the moment I want to use to tell a little story about myself. I remember I went to the hospital. I was in pain. The lady asked me, the nurse asked me for a pee, asked me for urine, right? And I said, I thought to myself, like, why does she need urine? But, I'm not the doctor, so I'm not the nurse, so I just gave the urine. Do you know that these people were drug testing me to see if I had drugs in my system before they actually took my pain seriously? Because that's another thing about the explicit racism that goes on in the healthcare industry. A lot of these people think when black people come in, oh, you're homeless, or oh, you're on drugs, and you're just faking because you want a place to sleep, or you just want us to get you high. Because like that was explained earlier in the clip, that people like, oh, black people don't feel the same pain as white people. When you believe stuff like that and a black person comes to you and saying they're in pain, you're thinking, well, they just want to get high. They just want painkillers to get high or to sell them. And that leads to a lot of black people dying. And I don't know how else to even carry on this video, because it's very emotional for me, because like I always said when I was younger, and like people always said, we always knew about, oh, that's the racist hospital. Don't go over there. That's the racist hospital. They're going to kill you. You're going to go there with one thing and then they're going to find another thing and you're going to die. Because we all know somebody who has died that we felt in our spirit that they shouldn't have died, that the doctors did something or they didn't do enough. We all felt that. Everybody I know felt that. Everybody I know experienced that. And now that I'm older, I know it wasn't just a feeling, it is true. But I want to play another clip showing and highlighting the racism so we can bring this full circle of a black woman. She went to the hospital. She went to several hospitals complaining about pain in her body. And none of the doctors actually did anything for her. They didn't even give her, forget inadequate care. They gave her no care. And she ended up dying in the cell because they called the police on her. They didn't, just like the other lady, Barbara Dawson, from the beginning. They just called the police on her and she ended up dying in police custody. Like, this is very hard to watch, but it needs to be played. Because again, it's emotional to me because something like this happened with one of my kids, where we went bouncing around from hospital to hospital to hospital, and we could not get the doctors or the nurses or anything to even do the most basic exam. They just looked at him and said, well, he doesn't look too sick to me. Oh, he's fine. They ran no tests. No tests. It literally took a white friend of the family to get them to do anything. But we brought him to another hospital, and the white friend of the family brought him in, and they got them to do something, and we found out what was wrong. And other stories I have like this in my life, but I don't want to drag this out too long. Like, this is going on long enough. Let's just watch the clip.
It's promise. I swear to God, on my daddy, you bastard on me.
Because one time black female from New York station mileage 64330 64330.
Swear to God, on my daddy, to watch. Fuck a lawsuit. I don't want you to breathe.
7 Joe, you want to be
As you saw, family, that was Ann Brown. She died and she didn't need to die. And as you saw at the end, I also tacked on a little bit longer extended version of the Barbara Dawson incident. I felt both of them needed to be showed because these two right here are the ones that really, really, really hurt me so much. And they really radicalized me on this issue. Not just my own personal life, but like seeing that really hurt me. So when you see clowns like this, like the goofball, the white no authority, and all these other goofballs making it seem like this is not a big deal, it's okay. Oh, Democrats are this, or oh, you're a Democratic shield. Pay them no mind. Pay them no mind. These goofballs. Oh, I just can't even speak. I just got to end this video. It's going on long enough. Make sure you like, share, subscribe. Drop me a comment. Tell me what you think. Make sure you hit that bell. Also, make sure you donate to me. You can. PayPal or Cash App. Follow me on all my social media sites. You can also email me if you want. And yeah, I'm just going to end this video here. Part 2 will be about junk food. RFK Jr. and junk food. And on that note, family, peace.